Hi there, and welcome to the Alberta Update. A look at what's happening in your province. I am your host, Bruce McAllister. Thanks for being with us today. Coming up on the program, the Premier is going to drop by. Lots to chat about keeping Ottawa in its lane and the dramatic stories coming out of BC as their approach to recovery and addiction is much different than ours in Alberta. Minister Rick McIver will be here. We'll have an in-depth chat about the Provincial Priorities Act and the impact that will have on our province and our relationship with Ottawa. Plus, Minister Dan Williams joins us to talk about the healthcare refocusing and the changes that are coming up in mental health and addiction here in Alberta. All that and much more straight ahead on the Alberta Update. All right, let's welcome the Premier in to kick things off. Premier, always great to see you. Thanks for taking the time.
Thanks, Bruce.
Let's talk about the Provincial Priorities Act first, which you unveiled this week. Look, this appears to be another case where you have to step in, the government has to step in and tell Ottawa to stay in its lane.
Oh, completely. And, people shouldn't be surprised by this because I have said right from the beginning that I wanted our province to be treated just like Quebec. And when I was at a recent Council of the Federation meeting, I discovered that Quebec has a piece of legislation that forces the federal government to stay in its own lane, particularly when it comes to signing deals with municipalities. They're just simply not allowed to do it. The federal government is compelled to partner with the provincial government so that they can get fair arrangements. And we just saw a dramatic example of why this matters so much. In Quebec, they signed a one-time $900 million housing accelerator agreement, which allows for Quebec to treat all of its municipalities fairly and ensure that the money is going to the municipalities who need it most. When in Alberta, by contrast, the federal government has been picking winners and losers. They've been flying in, announcing one-time agreements, putting onerous restrictions on our municipalities, pitting urban against rural and one municipality against the other, and massively shortchanging our province on what we're entitled to from a per capita basis. Like, one of the things you have to remember, Bruce, is Alberta continues to pay more in federal taxes than we get back in federal program spending. It is because of these kinds of unfair deals that they sign. And we're just, we're drawing a line. We're saying, you're not going to do that anymore. If you want to have a cooperative federalism, treat us just like Quebec.
I'm going to chat with Minister McIver about this in a few minutes, and we'll flesh it out a little bit more. But just one more quick one on it. This is really just another way, it seems, of Ottawa to pick winners and losers, and perhaps bypass you and go to some of their friends in government.
And it shouldn't be that way. That's not how our country is supposed to work. Like, I get that there are partisan differences that we have, but when you get into government, you're supposed to put partisanship aside and do what's best for your people. And whether that's Albertans in my case, or whether it's all Canadians in his case. And it's not like he doesn't know how to do this. We just had a bilateral agreement that was signed with the federal government on the healthcare funding. It was a 10-year deal. And what we agreed to at the provincial table was that we would all demand equal per capita funding, that we wouldn't allow the federal government to divide and conquer and play one off against the other. In fact, the provinces went so far as to say if any province is somehow able to negotiate something better, then it applies to all of us. So the federal government knows in some of those big areas that he's supposed to come and work collaboratively with us. He just chooses not to in some areas, and that's plain politics. And we think that's unfair. We think that this is the way that we can make sure that all of our municipalities get the funding that they need in order to be able to fund a growing population.
Well, it is. You're right. And Albertans are awake to it. I think more Canadians are becoming awake too. And listen, on that note, let's talk about the carbon tax. Protests are still underway here in Alberta and across the country. The cost of everything has gone up. Heating your home, gas, inflation is much worse. You and some other premiers asked for a meeting with the Prime Minister to talk about this. His response just completely baffles me. We met with the premiers in 2016, is what he said.
I think somebody has reported that not a single one of the premiers that he supposedly met with in 2016 are around today. And you have to remember where things were at in 2016. That was a government that was promising that the upper limit on the carbon tax would be $50 per ton. Well, they've blown past that. It's now $80 per ton, on its way to $170 per ton. And now they're being cagey about whether it would go up again if they were to win re-election. There absolutely is a need for us to have a look. Is the carbon tax working? Is it reducing emissions? Is it changing behavior? Or is it just a punitive tax? You'll probably have a pretty good idea of where I'm coming from on that. Because if the options to change to different fuels aren't available to people, for whether it's gasoline or diesel vehicles or whether it's home heating, then it really is just punishing people for trying to keep warm and keep the lights on in winter and be able to get the kids to soccer practice or pick up groceries. And that's not a reasonable thing for the federal government to be doing. They should be alive to the fact that they've created an affordability crisis. The cost of everything is going up. The frustration people have at seeing a tax that is not delivering on what it was promised for and is just punitive. He's I think Doug Ford said it best. They don't do something about this. They're done like dinner. People have had enough of it.
Yep, no question. Listen, one more before I let you go. And I know you have seen there have been some troubling stories coming out of British Columbia concerning addiction, recovery, mental health, and that province's approach to dealing with these things. Some nurses have been saying, look, what we're being asked to do with people that are using hard drugs is just beyond the pale. It's not what our occupation ought to be. This is not the road that Alberta intends to go down. Do you want to comment on what you're seeing out of BC?
Well, I hope you can do a little bit more on that, because I did table in the legislature this week the column by Adam Zivo, and it paints a pretty harrowing story for our frontline nurses because of what they call decriminalization and safe supply. They basically have government funded hard opioids that they give to addicts. They have interpreted that to mean that nurses are not allowed to ask people to stop smoking crack. They're not allowed to take away weapons. They're not allowed to stop their drug dealers from showing up. In fact, it's gone so far as they're expected, in the name of harm reduction, to pour alcohol for alcoholics and provide crack pipes for those who are smoking crack. What they're seeing happen is that the drug addicts are asking for 20 crack pipes and then going out and selling them on the street. There's even one terrible story of a pregnant nurse after she'd had her baby. She was counseled not to breastfeed because of the exposure to secondhand fentanyl. That is bananas. You absolutely cannot create that kind of environment for our hardworking frontline professionals, our hardworking nurses. And I just had to draw a line saying, you know what, we know what it is that NDP policy looks like. It's being implemented in British Columbia. That is not something that we are going to do in this province. We absolutely are going to support a recovery-oriented system of care, virtual opioid dependency program that gets people on replacements for hardcore opioids, building out our recovery centers, building out mental health support. Those are the kind of things that are going to lead people back onto a road of recovery and independence. And it is absolutely the right thing for somebody who's suffering from the disease of addiction. But most importantly, it is absolutely essential so that we can keep a functional and supportive environment for our hardworking frontline nurses.
So many in Alberta are happy to hear you say those things. And Premier, you should know we do have Minister Dan Williams coming up in a few minutes to talk about this a little more in depth. Listen, I know you've got more to do. Thank you for taking some time. We always appreciate it. As we touched on with the Premier, Alberta is taking steps to ensure the federal government isn't overstepping its jurisdiction by introducing new rules that limit their ability to intrude on provincial priorities. Well, one of the ministers in charge of this, in fact, the minister, is the Minister of Municipal Affairs, Rick McIver, who joins us to chat more about it. Good day, Minister.
Hey, Bruce. It's good to be here with you.
We appreciate it. Listen, an announcement about this week. In your remarks at that press conference, you mentioned Alberta is not getting its fair share of federal funding. What do Albertans need to understand about this?
Albertans need to understand that the federal government under Justin Trudeau is hostile towards Alberta for no particular good reason, but he is. And it's costing us money that we need and deserve to build important infrastructure and provide social services and to allow municipalities to build housing. And the federal government is doing two things. First of all, they're way out of their lane, trying to change municipal rules around land use and planning. They got no business being there. It's none of their jurisdiction. Constitutionally, it's 100% provincial jurisdiction. And while they're running around here taking liberties that don't belong to them with demanding things from municipalities, it's twice as insulting because they're not providing us with the same funding that every other province in Alberta gets. Alberta has about 12% of Canada's population. Somewhere the housing funding committed so far is probably half of that, maybe less. And here's the most extreme example that really, to me, points to just how bad it is. 2-3 weeks ago, federal housing minister rolled into Edmonton, committed $175 million, which is fine that they're helping with housing, but while demanding a whole bunch of changes to their land use bylaws that the minister has no right to do. And just to make sure we know how bad it is, the next day he goes to British Columbia, which has a very similar population number to Albertans, and he drops $2 billion, more than 10 times as much. So to say Alberta's getting a bad deal, a raw deal, whatever way you want to say it, is an understatement.
Yeah, listen, appreciate that. That's good context. How will this legislation, we talk a lot about Calgary and Edmonton, and I'm going to come back to that in a second, but how will this benefit or help rural municipalities, Minister?
Well, it will be. It will certainly. They're not getting any help now. The federal government has promised some money to Calgary, some to Edmonton, and about half a dozen other Alberta municipalities. And we have about 330 municipalities. So the other 220, 225 odd municipalities are now getting nothing, while Alberta gets, depending on how you look at it, 20% to 50% of what other province gets. So we're standing up for Alberta under the leadership of Premier Smith, and we're saying to Ottawa, no, we want to be treated fairly. Like, we're not a subservient government under Canada's constitution. We're a fellow government, and we want the same funding formula as what Quebec gets. It has gotten for a long time, and we're not going to sit silently anymore while they treat us terribly and take us for granted.
Some of the bigger cities, I think Edmonton and Calgary, have current agreements with the feds on some other things. How will this impact? How will the Provincial Priorities Act impact those?
Well, the agreements in place now, I would say in most cases, will be unaffected. I mean, all future agreements will have to have the province on as a signatory, unless the current agreements are completely ridiculous. And here's what I'm most afraid of with the agreements with Calgary and Edmonton, because my understanding and belief is the agreement that the federal government signed with Kelowna is that after 2030, they don't allow natural gas hookups to homes. Well, our provincial government cannot allow that to stand in Calgary or Edmonton or any place else in Alberta. That's not what the Ottawa government gets to do. They've been trying to shut down our largest and most profitable industry, the energy industry, for decades. We can't allow it. And again, to add insult to injury, it's the one that probably provides the most money to the federal government from a province to help build countrywide infrastructure. It comes out of Alberta from that very industry.
Yeah, listen, that makes it clear that it's ideological, doesn't it? I know you'd agree with me on that point. I want to ask you one more, Minister, and I got to move on. But how is the federal minister who you referenced earlier? How has he responded to our request to be included to have some of these funding changes made?
Very badly. You know what? As about a week ago, I would call a really nice, positive, cordial conversation with Minister Sean Fraser, the federal housing minister. And he was as friendly as could be. And I said, you know what? We're really happy to work with you as long as you remember that we are the province and that I am the provincial municipal affairs minister. And I said to him, as long as you don't want to be the municipal affairs minister, and as long as you don't want to be the province, we're going to get along just fine. And he said to me with a big smile, we're not going to have any problem then, because I am not the least bit interested in any of that. And about a half a week later, he rolls out with policies exactly the opposite of what he said. Exactly what he said he would not do is exactly what he did. So, we had a nice conversation. I won't take that back. I was sincere on my side. Mm-hmm. The kindest thing I can say is that maybe he didn't remember what he said. Every other conclusion I could come to is a lot less kind than he didn't remember.
Well, I would tend to pick one of those for what it's worth. Anyway, Minister, we're glad you're there fighting for us. We appreciate it. Thanks for your time today.
You know, Bruce, it's great to be here, and I look forward to talking to you again. Thanks.
Minister of Municipal Affairs, Rick McIver. Well, every Albertan deserves timely access to high-quality medical care, regardless of where they live. That is why Alberta's government is investing over $224 million to develop 2 rural medical education program training centers in Lethbridge and in Grand Prairie. Once completed, both these training centers will contribute over 100 doctors every year. year. As Advanced Education Minister Rajan Sonia tells us, students who are in rural communities are more likely to stay and practice in those communities when they are done their education.
I am so thrilled to be here at the University of Lethbridge to announce a phenomenal program that is going to bring more physicians to rural areas. So we're going to announce the Rural Medical Education Program Training Centres today. Alberta's government is investing a total of $224.8 million to train more physicians in rural areas. The training center will allow students to do their undergraduate medical education, and the training clinics will allow them to have that clinical hands-on experience. So the fact that we're opening up these rural training centers in Grand Prairie and Lethbridge is going to be incredibly advantageous to the entire province, because students who are living in the surrounding areas will be attracted to these programs. And of course, when students study in these areas, they tend to practice there as well. So the benefit to Albertans in the north and south is going to be palpable once these programs are in place and once the expansion is fully completed.
Alberta's government is also delivering on a commitment to provide funding to help family doctors with their administrative costs so that they can devote more time to seeing the patients in this province. The additional one-time funding has been provided to the Alberta Medical Association as part of a commitment of $200 million over 2 years to stabilize primary health care. The AMA will distribute that funding to eligible family physicians and rural generalists until a new physician compensation model is in place. The Alberta government has been taking steps to address the challenges facing the healthcare system. We have been reporting on that. That includes refocusing the system into 4 priority areas: primary care, acute care, continuing care, and mental health and addiction. And that is as a big one. And this past week, Minister of Mental Health and Addiction, that is Dan Williams, launched the first of those 4 priorities with Recovery Alberta and the Canadian Centre for Recovery Excellence, or CORE, as it is known. And Minister Williams joins us now to talk more about this. And Minister, this has been a big week, and frankly, it's been a big year for you. Thank you for joining us to tell us a little bit more.
I'm happy to let you know what we're up to.
Well, let's start with the announcement. What is going on to the focus of Recovery Alberta? How will it improve, I guess, Minister, addiction and mental health for Albertans?
So exactly as you described off the outset, we're creating 2 organizations here. Now, the first one, Recovery Alberta, is effectively in the refocusing of AHS. We're taking those funds, it's about $1.13 billion, that has programming and resources and staffing that go towards mental health and addiction within AHS. And we're saying we're standing up this dedicated organization. So we don't have mid-level managers doing mental health and addiction off the side of the desk anymore. I don't blame any one individual within AHS or the healthcare system. In fact, I want to thank every single frontline healthcare professional, the nurses, the health care aides, the psychiatrists, the psychologists, the whole team for the work they do. The work that they do is life-saving. It's deeply important for us as a society in Alberta. And because of that, we need to give it the due focus it deserves. So since 2019, this government, as Conservatives, created the first Associate Ministry of Mental Health and Addiction. And then Premier Smith upgraded that to a full minister just over a year ago. And now this last stage, we've upgraded our budget from a $250 million budget, which is big, to over a $1.5 billion budget, which is monumental. There's no other jurisdiction in Canada that has focused this much on mental health and addiction. And we're focusing on it because it's what we hear from families, from individuals, from those suffering from mental health challenges, those suffering from depression and anxiety, from severe crises in their life, and to those suffering from the deadly disease of addiction. And so this organization, Recovery Alberta, is one of these steps on our path, starting in 2019 with a dedicated ministry, all the way to now, a dedicated healthcare delivery organization that's going to oversee these healthcare services for Albertans and is going to answer directly to the minister.
Minister, I know you and I could chat about this for 20 minutes, as we did it in the special budget edition. You're so passionate about it. I want to follow up in a few areas. The other part of that announcement was launching CORE. That is the Centre of Recovery Excellence. How will that interact with Recovery Alberta, and what is their role in this?
So CORE is a Crown corporation, and its relationship is going to be not just with Recovery Alberta and the following AHS bodies and the refocusing for continuing care and acute care and primary care, but also it'll have a relationship with other government ministries, justice, with seniors, community and social services around shelters, public safety and emergency services. And its purpose, similar to the Health Quality Council of Alberta within health, the purpose of CORE for the Centre of Excellence is to give us evidence-based review in terms of the policies we have, the programming we have. Is it based on evidence? Is this working? What's working well? What should we double down on to make sure we get the best results for Albertans when it comes to mental health and addiction? And what do we need to reform and refocus and get right? And so this is the heart of what evidence-based policymaking is in mental health and addiction. And it's also going to be able to partner with academic institutions and research bodies to give us a good sense of where do we need to grow and where is the best evidence and data across the world when it comes to this relatively new policy area of mental health and addiction.
Speaking of partnering, you are now doing some work with the governments in Ontario and in Saskatchewan, establishing a partnership to see what you might be able to do together, how you can work together. What do you think that'll look like, and what are you hoping to accomplish?
Well, it's a great partnership. We made the announcement last week in Calgary where we had Canada's largest recovery conference. And if you weren't there, you would have loved it. It was 2,000 people from across the country, even across the world. We have experts from the UK, from the United States, internationally, and a bunch of people who are in lived recovery. And they know what addiction is, and they've come through it. And they're witness, those 2,000 people in the sense of optimism, are witness and testimony to what's possible when you don't count people out. People who are suffering from addiction and say our only options to continue medicating you until you run the natural course of an addiction, which is unfortunately death. Instead, it's this light of hope that says recovery is possible. You can live a fulfilled life as an Albertan, as a Canadian, in spite of the deadly disease of addiction and overcome it in a meaningful way. And so we made the announcement in that context. And the announcement is a partnership between Saskatchewan with the minister, my counterpart there, and Ontario, my minister from the counterpart there, who came to Alberta, witnessed this conference, talked about the policy space that Alberta is creating, and they want to be a part of that same movement within Canada. Because just as our communities and cities are thirsting for something other than the status quo that the left has offered them for decades, they're together with Alberta saying, as Saskatchewan and Ontario, let's build a recovery-oriented system of care, one with hope, one that is going to find partnerships for best practices.
Minister, we had the Premier on at the top of the program here, and she was talking about some of the stories that are coming out of British Columbia. They're heart-wrenching, what the healthcare workers are having to deal with there. Listen, the Alberta recovery model is different. And every time I talk to you, I like you to be able to emphasize that and explain to Albertans and those watching us right now what we're doing differently here, and I guess how it is different than, as you say, the left and the safe supply folks would pitch that you address mental health, recovery, and addiction.
Right. So I think it's important to note that right next door to Alberta is a very different policy framework. The landscape there is different. What they have done is they've taken, and I'm not overstating this, the world's most radical policies anywhere found on earth when it comes to addiction. They've effectively decriminalized the use of all drugs, including in playgrounds and in schools, and they have effectively allowed it in practice in their healthcare facilities, which is what you and the Premier were talking about, where nurses are concerned to breastfeed because they may have inhaled secondhand fentanyl smoke and were recommended by their health professional not to breastfeed their own baby. I mean, it is, as in the Premier's words, bananas and beyond insane. And so that is an option on offer for Canadians, one that says, government supplies, taxpayer provided, high-powered opioids, 5 times more powerful than heroin, to the tune of 60-odd million pills a year, right? And then we're going to decriminalize the use with no sense of recourse for the law to try and get people into treatment and help and support they deserve. Alberta, by contrast, has rejected that and has said, you as a Canadian, as an Albertan, as a human, have a sense of dignity and worth, and we have a responsibility to give you that opportunity to recovery. And if you don't believe it's possible, I want to introduce you to 2,000 people who came together in Calgary. I want to introduce you to half my office, which are addicts in recovery from fentanyl to marijuana to crack cocaine. I want to introduce you to the Chief of Staff to the Premier, who's an addict in recovery and one of the most important and influential positions in provincial politics. I say this to illustrate that these individuals are people of great capacity, and to condemn them to this continued sort of slow motion train wreck that is addiction running its course unmitigated in your life, when we have the possibility of government to intervene and support you, that's what our government's about. To the point where we're going to be introducing next year legislation surrounding compassionate intervention for those who are a danger to themselves or their community because of their drug use, and every other option has been tried. The government is going to intervene. It's going to say enough is enough. It's not compassionate to leave you on the street in -40, intermittently homeless, doing fentanyl and methamphetamines. We need to help you get out of that, and that is going to be a response from our government with legislation soon to come.
The Minister of Mental Health and Addiction, Dan Williams. We appreciate the work you're doing, and thank you for taking the time to come on the program and talk about it with us.
Appreciate it. We'll see you guys soon.
Well, to help build stronger and more resilient communities across the province, Alberta's government is extending the Family Resource Networks program. These networks, which were first launched back in 2020, focus on programs that improve the well-being of children and youth through free prevention and early intervention supports. Minister of Children and Family Services, that is Cyril Turton, says these programs help families facing big challenges get help when and where they need it.
The family resource networks are having a positive impact on families and communities. And because of that, I'm so pleased to announce that through Budget 2024, Alberta's government is extending the Family Resource Networks program and providing an additional $6.6 million over the next 2 years. We're building on our previous investments to strengthen our networks in 3 key areas. The first area focuses on ensuring Indigenous children and families have access to culturally appropriate supports and services wherever they are. Secondly, we're making sure networks have the training and capacity to respond to the needs of LGBTQS+ and gender diverse children and youth. Our third focus is all about enhancing intensive services to meet the rising demand for these supports.
Alberta's regional airports connect people, of course. They create jobs and they help local businesses thrive and reach new markets. To foster the growth of the province's regional airport networks, Alberta's government is investing $1.13 million. Minister of Transportation and Economic Corridors, Devin Dreeshen, says this will help enable the seamless movement of people and goods and create more opportunities for municipalities and local industry to thrive.
Alberta's government recognizes the critical role our aviation industry plays in strengthening and diversifying our economy by expanding access to markets and creating jobs all across the province. In fact, the development of Alberta's airports with special attention to regional airports can help Albertans connect to major international airports and increase Alberta's economic competitiveness is actually part of my mandate from Premier Smith.
This funding will support projects at 10 regional airports across the province, from Grand Prairie and Fort McMurray to Medicine Hat and Lethbridge. Offering high school students career education enables young Albertans to have hands-on experiential learning opportunities that can lead to rewarding career opportunities to support more students in pursuing and transitioning into post-secondary trades or the workplace. Alberta's government is investing more than $4 million into dual credit programs. Education Minister Demetrius Nicolaitis saying the funding will also include new opportunities for high schools to develop new programs to support students in pursuing careers in healthcare.
School authorities have the flexibility to develop and implement dual credit programming that provides students with relevant learning experiences. Examples of new or enhanced dual credit opportunities in Alberta schools could include courses like carpentry and welding apprenticeships and training in artificial intelligence, medical and health technologies, and more. Targeted funding for healthcare aid dual credit grants aims to increase the number of students pursuing a career in the healthcare sector, which will help to alleviate growing workforce pressures.
and the future is certainly looking bright for Alberta students. And that does it for the Alberta update this week. A look at what's happening with your government and in your province. We appreciate you taking the time to join us. A reminder, you can join us. Just go to YouTube and subscribe there, and then you can follow us on the social media sites after that. Of course, we do this every week when the legislature is sitting, every other week when it is not. And again, thank you for sharing your time with us this week, and we'll see you again next week.